Hi, I'm Sally, the CEO of Clarity PX, and I want to talk to you today about the importance of integrative marketing strategies for rural healthcare, for community health, for smaller health and wellness businesses. It's really important that you don't rely on a single channel. So much of healthcare is geared toward consumers, which is appropriate. But much of healthcare is also driven by referrals or requires a referral from a physician. So there needs to be an integrated B2B and B2C strategy for your marketing to be really effective. And we see it all the time with clients where they want to spend money on a print ad or a billboard or something for a line of service that requires a referral from a specialist or another physician. So it's important to consider, what is the care line that you want to promote or the service line? Where are our clients coming from currently? What geography, what kind of representation do those patients have in common that show us where referrals are coming from? Can you identify specific practices or centers or hospitals or specific physicians that are referring a lot of patients to that care line? If so, that's really helpful information for you to have. The other thing to really look at is what other competition is in the region or in the drivable area for that service line. Do they have availability? Do they not have access for weeks or months? Take a look at the competitive kind of circle of what else is available in the region and how does your service compare differently or better than what might be available in the region. And then finally, I want you to take a look at what other entities exist within that region that would be able to support either referrals of clients direct or referrals through physicians. So, for example, if you're looking at a therapy referral or maybe an orthopedic referral you're looking for, you might look at surgery centers in the area. You might look at what other hospitals, urgent care centers, what other EDs are in the area. You might take a look at what other physical therapists are in the area. But I also encourage you to not forget that there are people at every layer of healthcare that are looking for services for their patients. So maybe you would look at long-term care facilities if you're an orthopedic provider and you have a specialist who does hips or that kind of thing, osteoporosis, whatever. If you want to really expand your growth in a specific care line, make sure you evaluate the full environment that you're operating within, and don't just throw up another billboard without having looked at it. Pay attention, your competitors, the other service folks in town, the referral sources. Where are patients coming from? What are your opportunities to capture market share? And then also consider, who are your payers? What are they covering and referring for? Do they have staff or care managers or folks on their team that are working to help with prior authorizations, with referrals for their members as well? All of this helps create an ecosystem that drives not just one-time bump, but a continuous growth in referral flow to your specific service line.